So, Dr. Dourado, it's a pleasure to meet you here at ILAR in Copenhagen. And we can start talking about your experience at the advanced workshop on SLE in Coimbra. So, can I ask you please, what do you think about the format of the SLEuro advanced workshop?
I think that the format of the course was very appropriate because it was designed so that we could both discuss how to organize our clinics, how to include research in our daily basis, but also how to manage the patients. So I think the format was very good for someone who is looking to not only taking care of their patients, but also do some research and help them in the future as well.
Okay, thank you. Does the workshop fulfill your expectation? If yes, why?
Yes, it not only I was glad with the workshop, but it was even better than what I was expecting because there was a close contact between the participants, and that included both unexperienced junior rheumatologists and residents, as well as very experienced rheumatologists, and we were able to exchange ideas about the current treatment of patients, but also about future perspectives, not only regarding the clinical questions, but also research questions, education questions. So I think it was very enriching because of this interaction.
Okay. And what was the topic that you are more interested in?
As a rheumatologist, I am naturally very interested in the treatment of articular, joint involvement of the different diseases, including lupus, but also having always an eye in the other manifestations. So I think the course was well organized regarding the different manifestations. We could discuss different topics, and in between the sessions we could also communicate very easily with everyone, so we could further share our experiences and share knowledge.
And what do you think about the session at the lupus clinic and your meeting with the patients?
Yes, it was very interesting because we can never lose focus on what is the most important and what is the ultimate goal of all our work, not only the research work, in which obviously we are trying to improve the future of lupus patients in this particular case, but also to hear the experience of someone who is followed in a very specific clinic, very organized, and try to understand what the patient feels about this kind of clinic, and what they can gain with this kind of structured, organized evaluation, because it's very easy for us to see the doctor's point of view. It's not always easy to see the patient's point of view, and in our daily basis we don't have the time to talk to the patients about every detail of the appointments and what they like the most, what they feel about the clinics themselves.
Okay. And you have some suggestion in regard of the future organizations of the workshops?
Yes, I think that first of all we should keep doing these workshops because they are very important for everyone involved. And I think that the model was a good model. It should keep the core structure. What could we do different? I mean, we could always talk about different manifestations because, well, in lupus we can choose from a million different manifestations, but always keeping in mind the center, the patient-centered care that we all want to give to our patients.
Okay. And do you want to say something to the professors that you have met during the workshop?
Sure, I want to thank them all for being so kind, so easy to approach, and to thank them for the tips that they gave us, not only in the sessions but also in between. As I said, I think it was a wonderful experience, and it was really nice to meet them in person, because you know their names, but it's very nice to know their faces and to talk to them as well. Thank you very much.
Thank you very much, Dr. Dourado. Thank you.